More than 3,000 people are dying of COVID-19 every week, and we haven't even reached the fall and winter seasons when the virus hits the population the hardest. And yet, the CDC is relaxing its pandemic guidelines. The agency called the new standards streamlined and said they will, quote, help people better understand their risk, how to protect themselves and others, what actions to take if exposed to COVID-19, and what actions to take if they are sick or test positive for the virus, because honestly, the government is done trying. Not like it ever tried to begin with. Individuals exposed to the virus are no longer recommended to quarantine. That applies now to both vaccinated and unvaccinated people. It also applies to students who are exposed. The health agency also dropped its recommendation to do regular testing of asymptomatic people in workplaces like schools, and it no longer prioritizes social distancing. Are we sure the coronavirus itself didn't write these? CDC operating strictly on vibes now. Or if there's any real motivation here, it's to ensure that capital has a large enough workforce to exploit. Last time the CDC relaxed guidelines like this, it was because businesses told them they needed sick workers to be forced back onto the job, and so the CDC cut down the recommended quarantine time for people who test positive and are showing symptoms in order to get them back to work faster. Now, in this latest revision, the health agency ignored a number of studies about how COVID spreads and what it does to people. For one, research shows that those who test positive for COVID can still spread the virus for up to 8 days, sometimes longer. Yet the CDC only recommends 5 days of quarantine. A new study published in the journal MedRxiv shows a direct correlation between loosening mask restrictions and increased COVID infections. Researchers looked at schools in Massachusetts that dropped mask requirements halfway through the year and found a sharp rise in COVID cases in both students and staff. About 12,000 extra people were infected needlessly. And then there's the issue of long COVID. Policymakers want to rapidly transition into treating COVID just like it's the flu that we all live with. But unlike the flu, we don't fully understand the damage COVID causes on a long-term basis. Senator Tim Kaine has discussed his own long COVID symptoms since he acquired the virus way back in March 2020. For years, he's been dealing with tingling in his nerves. And lingering symptoms affect as many as 1 in 4 people who get the virus. Considering that about 100 million people have gotten it in the US, well, that's a lot of long COVID. Could be upwards of 30 million cases. And most of those people are still going to work, only sick. Government still doesn't have a firm handle on just how many people have been forced out of the labor market as a result of debilitating long COVID, but the number is likely in the millions. And it will only keep increasing as the federal government and local governments drop all mitigation strategies and basically tell people, you're on your own. CDC's relaxed guidance comes just as the FDA announced there will be no second boosters for healthy people under the age of 50. The added layer of protection was approved for older Americans and those who have compromised immune systems, and there were discussions about opening it up to everyone. But that won't happen. Instead, the plan is for people to wait until the fall to get the so-called next generation of boosters that are being developed to respond to new COVID variants. It's assuming there's enough money for the government to purchase enough doses, since Congress hasn't approved new funding and the White House has explicitly said it won't be able to invest in new vaccines without the money. Or perhaps the plan is people will now just have to pay out of pocket for the doses. That truly would be a return to normal. What sucks is that a lot of people are coming up on almost a year since they had their last COVID booster. We know that vaccine effectiveness wanes over time, and we also know that the variants are more contagious and can often break through vaccine protection. Take it from me, as someone who had 3 COVID shots, most recent at the end of last year, and still got sick as shit when I got COVID last month. Take all these decisions by public health officials combined, and it's shaping up to be a sick boy summer. Hey, thanks for watching. Hit the subscribe button so you don't miss any of our new videos. Also, if you want to see Means Morning News in its complete form, not just the clips we post here. Head on over to Means TV and get access to all our new episodes and our entire backlog, plus tons of other great movies and original TV shows.